Assalamualaikum. My name is Dr. Sayyid Hassan Mahmood. I'm an infectious disease specialist and I head the infectious disease section at the Afghan University.
So are we having the second wave, and how is it different from the first one?
So at this point it seems that we are entering the second wave of COVID-19 in Pakistan, which means that after our rates have come down, they have now started to come up again, and we are currently probably in the beginning of the second wave. We expect that this wave is going to be slightly different from the previous one, in that since this is winter and we see a lot of normal sort of cold, cough viruses, it's going to be much tougher for us to distinguish between COVID-19 and your normal respiratory tract infections. And that would mean that we may need to do a lot more tests to find out which this patient has. At the same time, keep in mind that our hospitals are already full of non-COVID patients, while previously our healthcare system had almost ground to a halt, allowing us to divert resources into COVID-19, and this time this may actually not be possible. However, the good news is that we are much better treating this infection. People are more aware of this infection, and therefore we hope that we will be able to manage patients who do make it to the hospital in time for care.
So how are patients different this time than the last time?
So in this wave of COVID-19, we're actually seeing pretty much almost the same type of patients that we saw last time. Mostly the elderly, people with other medical problems are coming into the hospital with severe illness. However, we're seeing the infection in the entire age range as expected. We do not feel the virus has mutated, has changed. The behavior of the virus is pretty much the way it was before. However, having said this, the question then becomes, why did this virus come back? And there are many reasons. One is we know that when it gets cooler, these sort of viruses which are spread through the respiratory tract tend to spread much more easily. At the same time, we all know that everybody's become complacent, mask wearing is at an all-time low. People are now gathering together in weddings, in other public gatherings, which really helps this virus to spread a lot. And once this virus takes a foothold, it really spreads exponentially unless something is done. Unfortunately, we have seen a number of patients who had the COVID-19 in the previous wave coming now again with symptoms all over again, and when we test them, they have a very high virus level, indicating that they've got infected again. This is a good warning for us that even if you've had the infection in the past, please keep taking precautions, because we don't know how many people with the infection in the past will get the infection again.
What does the trial of vaccine means for Pakistan, and how soon can we expect one?
As you may be aware, we are now currently undergoing one vaccine trial in Pakistan, and we expect more to come. Remember, there are a number of vaccine trials happening around the world, and even the one that's happening in Pakistan, Pakistan is just one of many countries where this particular vaccine is being tested. Regardless, once the vaccine trial ends and we know if this vaccine works or not, we do not expect the vaccine to come to the country for distribution at least by mid of next year, which again, I should re-emphasize that we need to take precautions until the vaccine arrives. Keep in mind that even after the vaccine arrives, it is possible that the vaccine alone will not be enough to halt this virus, and even after the vaccine comes, we still may need to take some degree of precautions to stop the spread of this virus.
If I have mild symptoms, is it necessary for me to quarantine?
So, unfortunately, because we cannot really tell between a common cough and cold virus and this COVID-19 virus, if you have mild symptoms, it's better that you get tested and then go into isolation, because treatment for both are slightly different, and also we need to know if you're contagious, if you can give this virus to other people or not. Similarly, if you have COVID-19, the duration of isolation is also slightly different than somebody who may have a common viral infection for which there is really not much isolation required. So bottom line, if you feel you have the infection, if you have fever, body aches, cough, loss of smell, loss of taste, then please get yourself tested and go into isolation until your result comes.